So today, we're going to tackle a real paradox of modern medicine: opioid analgesics. I mean, these are some of our most powerful weapons against human suffering, but at the same time, they're at the heart of a devastating crisis. We're going to break down the science of exactly how they work, from a single tiny nerve cell all the way up to the entire human body.
You know, it's a question that feels like it's straight out of science fiction, right? You're in some kind of excruciating pain, you take a pill, and poof, the pain just starts to fade. But what is actually happening inside your body to make that possible? Well, we're going to get to the bottom of that exact question.
First, let's just set the scene a little. The search for a way to stop severe pain, that's not a new thing. It is as old as humanity itself. This is a fundamental, universal human quest.
Okay, so first up, a key term you need to know: analgesic. Basically, an analgesic is any drug that relieves pain. But here's the really important part. Analgesics don't fix what's causing the pain. They only treat the symptom. It's kind of like turning down the volume on a fire alarm, but without actually putting out the fire.
Now, within that big category of analgesics, there's a very specific, and I mean very powerful group, the opioid analgesics. When it comes to serious pain relief, these are the real heavy hitters.
So opioids are these incredibly potent, morphine-like drugs, and their real secret? It's precision. They work by zeroing in on very specific targets in your central nervous system called opiate receptors. And that targeted action is the key to everything.
And the term opioid isn't just one thing. It's really an umbrella term for a whole family of drugs. You've got the natural ones, the OGs, like morphine and codeine, which comes straight from the opium poppy, Papaver somniferum. Then you've got all the synthetic and semi-synthetic versions cooked up in a lab. But here's the thing. They all produce that same core morphine-like effect in your body.
Okay, so how do they actually pull this off? This is where the science gets, honestly, just incredible. We're going to peel back the layers and look at the precise biological machinery that lets a chemical compound completely silence pain.
The entire story, the whole magic trick, it all unfolds at these things called opioid receptors. The easiest way to picture it is with a simple lock and key. The receptors are the locks, and they're scattered all through your brain and nervous system. The opioid drug? That's the key, and it's a key that fits those locks perfectly. And here's a wild thought. Your body actually makes its own natural keys called endorphins that use these exact same locks to manage pain every day.
Now, there are a few different types of these receptor locks, but in pharmacology, we really focus on three main ones: mu, kappa, and delta. When an opioid key turns any of these locks, you get what we call analgesia. That's pain relief. But as you're about to see, they do a whole lot more than just that.
All right, let's zoom all the way in, down to the microscopic level. Right here is the synapse, that tiny gap where one nerve cell talks to the next one. So normally, a pain signal zips down and it tells that first cell to release chemicals to pass the message on. But when an opioid is in the picture, it's like a bouncer at a club. It steps in and acts like a gatekeeper. It basically tells the first cell, nope, you're not sending that pain message, and it tells the second cell, and you're not going to listen for it either. The result? The pain signal is stopped dead in its tracks.
Okay, so that's what's happening at one tiny connection. Now, let's zoom back out and look at the big picture. That gatekeeping action we just saw, it's not just happening in one place. It's happening at all these critical checkpoints along what you can think of as the body's pain superhighway. Opioids can block the signal way out at the nerves near your injury. They can block it again when it tries to go up your spinal cord, and they can even block it in the brain itself, changing how you even perceive the pain.
And this unbelievable power, this ability to just shut down pain, that's what makes these drugs so incredibly valuable. But, and this is a huge but, it also comes with an immense amount of peril. They are the definition of a double-edged sword.
You can see this duality perfectly if you just look at that mu receptor, the main target for drugs like morphine. When you activate it, you get the power, fantastic pain relief, sedation, even a sense of euphoria. But activating that exact same mechanism also brings the peril, life-threatening respiratory depression, physical dependence, and other side effects. The good and the bad are totally intertwined.
And here's what happens when you use them over and over. Your body is smart. It adapts. This leads to something called tolerance, which means you start needing more and more of the drug just to get the same effect. And it also causes physical dependence. That means your body now literally feels like it needs the drug to function normally. If you stop, you get hit with awful withdrawal symptoms.
And that leads us to the ultimate danger. That same mechanism that makes you feel sedated and calm, At a high enough dose, it can actually suppress your body's most basic automatic drive to breathe. In an overdose, the brain just stops telling the lungs to do their job. It's that simple, and it's that terrifying.
It sounds like a one-way street, right? But what if there was a way to just flip an off switch? What if science found a way to slam on the brakes and reverse that life-threatening effect? Well, turns out it did.
This is where we meet the hero of our story, the opioid antagonist. And the most famous one, the one you've probably heard of, is naloxone. This is a rescue drug, plain and simple, designed to do one thing: reverse an opioid overdose and save a life.
So how does this miracle drug actually work? It all comes down to competition. Remember our locks and keys? Okay, so in an overdose, all the opioid receptors, the locks, are filled with opioid keys. Naloxone comes in, and it's like a chemical bully. It has a much stronger attraction or a higher affinity for those locks. So when it shows up, it literally rushes in, kicks the opioid molecules out, and takes their place. But here's the genius part. Naloxone blocks the lock, but it doesn't turn the key. It just sits there. And by doing that, it instantly reverses the opioid's effects. And most importantly, it lets the person start breathing again.
And that brings us right back to where we started, doesn't it? Opioids are one of medicine's greatest achievements against pain, and at the same time, one of its greatest challenges. The science shows us this incredibly fine line between relief and risk. So the question that's left for all of us is, how do we manage that balance? How do we use the power without succumbing to the peril?